Okay, Fortis folks, this is what terminology class for Fortis, week number 5. This is part 2 of the run through. We did the first part, which was about 11 minutes, and this is part 2. We're just going to focus on this right here, which is the ear, the oído, right? The pinna, as this is called out here, and each one of these little areas in here does have a name. But in the lobe, etc., and all this, the crux, and all of these kind of things, just means cross. A lot of them are very important in things like acupuncture, actually, and a technique called NADA, which is good for what's it called? Things that you can't get rid of. What's it called? Addictions. There we go. So let's talk about the ear just a little bit. I'm going to go through some of these words really quickly in this little picture right here. And we're going to go through. So sound has to come in through vibrations in a medium which is like either water or air. Now you can hear from water way further, and especially deeper sounds, lower vibrations, which are measured in hertz. You can hear them much deeper in water than you can in air. So you hear things like whales, all that kind of stuff. But as it goes into this green area, the ear canal, which has little hairs in there, and those hairs keep bugs out and stuff like that. And you have also some earwax, sebum, which is actually a kind of sweat, and it's just a thicker version. The more interesting weird fact, if you get more cerebrum or sebum, actually Q-tip, like you get in there and you're digging around, which you don't dig too far because you don't want to poke this thing called the tympanum, which is the tympanum is the eardrum itself. There's a little like it looks like wax paper, actually. It's a little like thing that vibrates as the airwaves hit it. So as you get in there, if the more stressed you are, the more earwax that you will have. And don't taste it. It doesn't taste well at all. Anyway, how do you find out about that? Well, you pick up a pen from somebody and you sign something and you go like this. That doesn't taste good. That's not mine, I don't think. Bleh. Ear canal all the way in to tympanum is the eardrum, okay? And as we go into there, you have a cavity, an open space in there, and it leads down to this little tube, which goes from in here down into here. So when you go like this, and you hear it, boof, like that, you plug your nose and you equalize or whatever, which we do during a squeeze when you're scuba diving. That's pushing air through a thing called eustachian tube, okay? The round window, this little like octopus looking thing, looks kind of like an octopus to me because it has a little like, it's called a cochlea. And over here we have these semicircular canals. Those semicircular means partially circular canals. They're open spaces, and they're in 3 different basically orientations. Now you've heard the x-axis and the y-axis and then the z-axis. So it has 3 different, so you can have like a feeling of 3 dimensions as you lean around. It helps you with balance and proprioception, knowing where you are in space. The incus, the malleus, and the stapes in here. The malleus was the term for hammer, right? The incus is like a what's that thing called? It's an anvil, and then the stapes, it looks like a stirrup, actually, and it's connected to an oval, another window. There's the round window at the bottom and an oval window, so 2 little windows shape, right? Little open spaces, and as that pushes on that pushes this little goo that's inside here, right? There's a little fluid that's inside there, and that stimulates little tiny hairs all the way around this inside the cochlea. And that stimulates the nerve, which goes the cochlear nerve, which goes straight back to the temporal lobe. Vestibular nerve, that's the one that it connects up here to the semicircular canals. Vestibular, that gives you your balance, right? So 3 things you need for balance is where your feet are, where your eyes are looking, and what's going on inside your ear. You take one of those out, you tend to have a little bit of problem. Now, if we cut this off a little bit, as in when you get drunk, right, and then you do this like this test where they have you walk toe to heel and all that jazz, that's actually a vestibular test. So that's the ear in 5 minutes or less. And so otologists, Otolligist, otologists evaluate ear functions. Meniere's disease, they used to think that Vincent van Gogh may have had that because it's like buzzing and tingling and grinding inside your ear, and it drives you crazy, so he cut it off. We don't know, though. Labyrinthitis, inside the labyrinth. Inside here is what's called a labyrinth, which is an area of like confusing areas and hallways and things. And labyrinthitis is a inflammation of that, so you can get like dizzy spells or vertigo. They might just talk about vertigo somewhere in here, I suppose. blah, blah, blah. It does not. Okay. But anyway, vertigo, which is a sense of like you're spinning, sometimes it's one certain direction. You can have those kind of things. We can investigate vestibular disorders such as benign paroxysmal positional vertigo. There we go. Benign meaning it's not malignant, which is bad. Benign is like it'll go away by itself. Give it some time. Do some exercises or special exercises you can do to get rid of that, by the way. Paroxysmal means it has we don't know why that's really occurring. It's a paradox, and the paroxysmals, it's happening. We know the area, but we're not sure about it. Positional, what position your head is in. You turn your head this way and you feel like you're going to fall over. It's actually one of the tests. We hate that test. You can put someone in an office chair and spin them around, and if they follow the chair, that's a positive test. Why would we do that to someone? That's just mean. Anyway, vertigo. Vertigo is that feeling of spinning. So anyway, this is Dr. Sean over at FORTIS for week 5, part 2 of this is the ear. Talk to you guys later. Take care. This should answer some of the questions on there too.